Hello and welcome. My name is Camille Barga and I'm the Director of Recruitment here at the 12th Annual Pre-Health Professions National Conference. To begin, I would like to thank all the student volunteers and the AAMC for helping to make this conference possible. With us today is Dr. Raymond Christensen, board-certified family physician and co-founder of Gateway Family Health Clinic Limited in Moose Lake, Minnesota. Since 2002, he has been on the faculty at the University of Minnesota Medical School and serves as Associate Dean of Rural Health, Associate Professor of Family Medicine, and an Associate Director of the Rural Physicians Associate Program. He has served as an advisor also on the Commissioner of Health and on the Minnesota Healthcare Commission. He remains active in his professional societies and serves as the current president on the National Rural Health Association. Ladies and gentlemen, it is with great honor that I welcome to the stage Dr. Raymond Christensen.
Thank you very much and good afternoon. I think it only fitting on this pre-Columbus Day to step back a moment and recognize and thank the grandmothers and grandfathers of the native people of this land for this opportunity to be able to present to you today. My name is Ray Christensen. I work at the University of Minnesota. I don't know if the slides work. My office is in Duluth, Minnesota, and this is a shot of the aerial lift bridge of Duluth and probably the iconic shot of Duluth. Duluth is to the right of that picture. I'm going to talk a little bit about my background, about rural America and our demographics, rural competencies, admissions that we look at the University of Minnesota Duluth, and a little bit about experiential learning, which has kind of moved through the whole thing, balance, and I don't know if there'll be questions, but we'll try to get through as much as we can. I'm going to try to move right along. I'm a farm kid. I grew up in northwestern Wisconsin, oldest of 6 kids on a 40-acre dairy farm, kind of where the flat land hits the trees in northern Wisconsin, so it was tough going. At the age of 16, I left home and went to work for another farm and have got my 10,000 hours of learning in agriculture during that time. Interestingly, in high school, there was never time to study, so it was not something that I did. We also, as I look back to high school, did not have a lot of counseling. And as I look back now as an associate dean in a medical school, I look at the rural kids and look at the advice that we are giving our children in middle school, in high school, especially as relates to the medical professions. And it's not as deep and as thorough as it should be. When I got to college, of course, I floundered. The grades went right straight down. I've had them all. Dug that out, and then the question was vet medicine, PhD, and in the back of my mind there had always been medicine, which I didn't know if I could ever do. I found a good mentor and I was able to move on, and I've practiced in Moose Lake, Minnesota since 1972. How do I unfreeze this thing? There we go. This is Moose Lake and the campus where I practice. On the far lower corner is where the original clinic was. This is an old Hill-Burton hospital, kind of an H configuration. In 2004, after I'd left Moose Lake full-time, I'm still there 1 day a week, my partners built a new clinic up in the far upper right. We'd spent 25 years or 30 years attaching the clinic to the hospital, and now it's unattached. And I can only tell you, when you look for a place to practice, it's really nice to be attached. I think as you go through life, you should think about your personal mission. My mission has been one, originally to provide access to for rural citizens and our visitors to health care. And then in the last 30 years or so, that word quality has crept in more and more. A lot of debate of what quality means, but it is there. This view of the Duluth campus. The medical school in Duluth is there. The University of Minnesota has 2 campuses, one in the Twin Cities and one in Duluth. The one in Duluth is basically for rural family physicians. I'll show you that mission. This is the school itself. We kind of reside on the UMD campus in Duluth. The University of Minnesota is a land-grant university, And one of our responsibilities as a land-grant university is to provide physicians and other healthcare professionals across the state. And the Duluth Mission is to be a leader in educating physicians dedicated to family medicine to serve the healthcare needs of rural Minnesota and our Native American communities. We also do research, but our focus is really on rural family medicine. The question always comes up of when do you make that move from the general public or the lay public into medicine? I know for myself it was gross anatomy. Once you started working through the gross anatomy piece, you changed, but the white coat ceremony, I think more and more has done a lot to help the students make themselves and feel a part of the profession itself. I'm throwing in the AAFP mission just because I'm a family doc, but it is to improve the health of patients, families, and communities and serving the needs of its members. NRHA has a mission also. It's a page and a half long, and I'm not going to put it up. And the materials that I'm going to present now are basically from the NRHA homepage. As the president of the National Rural Health Association, I want to bring you greetings from the National Rural Health Association. Our association is a very diverse association, including physicians of all disciplines. The difference, if you don't understand professions, medicine is a profession, nursing is a profession. In medicine, there are disciplines, there's surgery, pediatrics, family medicine, and so on. We also represent hospital administration, nursing, NPPA, dentistry, optometry. It's a big tent organization. And as you listen to other specialties talk to you earlier today, and if you think about rural America, you realize that other specialties really are not necessarily spread across rural America. It's a big place out there. We also have a constituency group for students, and we welcome you to join. Our vision, really, it's pretty simple, your voice louder. We thought that was, some of us thought it was bad in the last year or two when we did that as we listened to Congress yell across the aisle, but still it's probably something to look at. We want you to understand that rural is very different than urban. And rural goes everything from frontier, less than 6 per square mile, to rural urbia, the Brainerd, Minnesotas, where you have a whole bunch of box stores and everything else, to the actual urban areas. In Minnesota, urban is 50,000 people or greater. Different states might have different ways of looking at that. But there's the economy and economic factors, cultural factors, educational shortcomings, recognition by legislation. In Minnesota, we used to have a predominance of rural legislators. We do not anymore. Less than half the population lives in the rural areas. And the other thing that's happened is our congressional districts are being anchored on the Twin Cities, which completely changes how our congressional districts look at rural. And in reality, we are aging. Basically, the doctor can only do so much. You just got to quit getting older, and I think we're facing an older and older society out there. We have about, last time I looked at the population clock for the United States, it was at 318 or 319 million. That was a few months ago. So we're about 320 million, and about 62 million people live in rural America. Those 62 million are somewhere between a quarter and a fifth of the size of the population. Yet only 10% of the physicians live in rural America. And if you think about it, you're dealing with demographics and geography. Demographics are numbers, geography is distance. You need to have enough physicians or health providers together so you don't burn them out. One person can't do it. And if you look at the millennial way of looking at professionalism versus an old mature like me who is willing to work 24 hours every day, it's not the same. And it shouldn't be. You're bringing some bright new ways of looking at it, and we're working very hard to make this work for you in rural America. We also note that there's a lack of mental health services. Certainly that's something that needs to be looked at. Emergency medicine, emergency needs. You heard from an emergency medicine doctor earlier today. We do not have emergency medicine doctors scattered around the country. A lot of us did all of that. We were emergency room docs. We delivered babies. We took care of kids and so on. We have a lot of accidents. There are higher speed accidents in the rural areas. We have a volunteer support system, and more it's getting very difficult to have volunteers that want to be EMS, fire department, or anyone else, mainly because when you consider what it does to your lifestyle. Oh, did this again. I need my Mac. The definition of rural is very difficult. And I throw this slide in. These are all different definitions of rural and places where you can look it up. I like the RUCAs, which are the rural urban commuting areas. This is a picture of Minnesota. The dark green areas are urban areas. In the far northwest, you've got Grand Forks, and then more central, Fargo-Moorhead, and down below in the lower corner, Sioux Falls, and then over to Mankato in the middle, and then Rochester, La Crosse across the way in the Twin Cities, and then Duluth in the northeast. You'll also notice that Duluth up in the northeast is in a large county that's bigger than some states. It has frontier and urban both in it. I like Alaska. I've had students in Alaska. This is a nurse practitioner's office, some distance between Glen Allen and Tok, which is way in the interior. She lives in the back and has a little office in the front. This is on the Iron Range, which is a more sub-regional hospital. So we have very much different size clinics scattered around. There are also a set of rural competencies. My dean asked me once, what's the difference between practicing in a rural area and practicing in an urban area? And we vetted these out, but I've never written them up because I don't have time to write. But basically, you need to be comfortable with isolation and uncertainty. If you're not, you can't be in a rural area. David Hilfiker wrote a great book called Healing the Wounded, and it really had to do with the stress of being on call in Grand Marais, Minnesota, 100 and some miles from any near big hospital. You need to make do with what you have. You have to practice with competency in disciplines and sometimes professions other than your own. And I always talk about the disposition window because I haven't got a better word, but it's a window that's always running when I see a patient, especially in the emergency room. Should I launch the bird? Should the bird be circling? Should it land? I need to be thinking all the time with the disposition, and that has to be going on at the same time I'm taking care of that patient. Then there's the question of boundaries and compartmentalizing your life. You fish with your patients, you go to the store and you see them. How do you handle that? And those are questions that you should think about. We have a lot of experiential opportunities. These are first year, the student with the stethoscope is a first year student. This is this past week with the third year students before they go out on RPAP, teaching injections, I think at that point. Emergency room again, in the clinics, first year medical student on rotation. So if we come down to Duluth, the things that we look for, and each medical school is going to be a little different, although I saw in your manual today, everybody's talking about shadowing, and shadowing in our admissions committee has gotten to be very, very important, especially for the PhDs that are on the admission committee. PhDs at our school have a lot to do with admissions. They've never been out, and they don't always realize that every family physician has a bit of a different practice. But we like to see you shadow. So we look for rural background. Are you from a small town? What are your ties to small towns? Where's grandpa and grandma from? Where'd mom and dad grow up? MCATs, you know, it's gotten to the point where people are more and more looking at the MCATs, and we want to have higher MCATs in the Twin Cities, and so on and so forth. But doggone it, average MCAT, generally to me, there's other competencies that I look for in a student besides just grade points and MCATs. And we try to search those out. Grade points are important too, but a 4.0 with no service, where you just sat and studied, that doesn't go a long way either. And sometimes those 4 points don't always line up with the MCAT so well. And incidentally, a high MCAT does not necessarily predict the outcomes of medical school. Altruism, third leg I look at, we look at the MCATs, the grade points, and altruism in the service. That is important. And I like to see something, especially in shadowing, well, 2 hours here and 2 hours there, I had a total of 6 hours of shadowing. I really like to see it say that I have spent significant time in these areas. A week, 2 weeks is great. And the real hard problem is finding a place to shadow. The docs today in family practice were as bad as any, I suspect the others too. We're busy, everybody's turning the crank, patients are every 10 minutes. How do you teach? How do you show shadowing? How do you do those things? And we have an obligation to you to do that. I think the best thing is go to the clinic, get out on your knees, and sit there until somebody comes and talks to you and is willing to give you an opportunity. Letters of recommendation are important. I already know your grades. I don't care. I don't need to see those again. I need you to have somebody write a letter that knows your heart. And it should be somebody that sat down and talked to you long enough to know what you're looking for in medicine, especially at our school, that you're looking to be a rural family doc or a rural physician, or where is your heart? And we like to see that in the letters. You should be able to describe the profession you're looking at. If you're coming and applying to medical school and want to be a doctor, and you don't know what a doctor does, it doesn't help your application. We also put on a pre-med summit, encourage people to go to that, where we talk about a lot of these things. We have pretty good attendance at that. This is not a good medical school outcome. There's not a damn thing wrong with my bedside manner, and some of us crotchety old guys probably get that way. But we like to teach our students to listen. There are 3 things that are important. We put a bump on your head. We teach you to do physical diagnosis. We teach you to handle complex medical problems. And we teach you to interact with patients. Those are the important things. This young man is talking to a very nice little lady. I didn't put her in the picture because I didn't have permission, but I always shoot my students because they've already signed away. Again, more surgical skills. What's important is when I go out and talk to the preceptors, we have students all over the state of Minnesota and some in Wisconsin. Teach them to suture, teach them to scrub. What that's telling me, it's not only the intellectual skills you need, but it's also procedural skills so that you can slip into the practice. When we send them out on the Rural Medical Scholars Program, we're going to teach them how to do CPR, AED, BLS, suturing, injections, intubation, scrubbing, and there's a couple others that I'm not clicking on right now. But we do a lot in that week. I'm the doctor that four out of five other doctors disagree with. That's okay. More students and their preceptors. This is Glen Allen, Alaska. If you know Alaska, it's where the Richardson meets the road going from Tok into Anchorage. So it's kind of in the middle. So the questions are, is it for you? These are service professions, and it's an opportunity to contribute to the health of the community and to the individual. We have a responsibility as physicians to take care of our patients and take care of the community, the public health piece. That's all part of being a physician. If we do that well, we don't need to worry about the rest. They'll take care of us. We need to lead in the community. We need to lead beyond the community. We need to lead nationally. You heard the discussions from Dr. Jenkins earlier. It's our responsibility to be advocates. I have appeared, advocacy started early on in my career. I don't know how I got into it, but I did. It's an idyllic place to raise your families. You get a chance to teach and mentor. Research is coming out more and more. The rewards are great. And there's always the respect piece too. So life is a journey. Mentors are important. You have your parents to start with. Each step along the way, there's a ladder of mentors that you need as you grow. Make sure you seek out good mentors. There are other things of value. Where's your heart? You heard that a little bit ago. It's important to know where your heart's at and follow that. The health professions require an immense and continued effort throughout your career. A lot of personal satisfaction. There will be jobs. It is a service industry. And I really, I hope I put it in. I didn't. There's one other point that I would bring up at this point. Remember the body, mind, and spirit. They have to balance. You need to exercise every day in medical school. You need to do it in college. You need to take care of your body and your mind and your spirit. And that'll help carry you through. This last slide is just a political commentary. The AMA has been talking about the market cure for a long time for health care, and it's not working. I don't know when that's going to happen, but we as a country, you as young people have a job ahead of you as to how do we take and bring health care where it needs to be. Health care is a public utility, just like roads, sewer, and water, electricity. We need a healthy country, and we need to get to that point. I grew up in the 60s. When I was at the University of Wisconsin, they blew up Sterling Hall with the riots that were going on through the Vietnam War. We came out of that, changed a lot of us, and we realized we could change society. You are young people, and you can do the same, and I really would put that challenge to you. Thank you very much for listening today. If there's any questions, I can step aside for them.